Welcome back. Now to the Olympic story that seems to have everyone talking, and it has nothing to do with sports. Bob Costas will return to his Olympic hosting duties tonight after a nasty eye infection forced him to take time off. It was the first time that Costas didn't anchor the primetime coverage of the Olympics since 1988. Let's talk about it. Dr. Jennifer Caudle is joining us now this morning from Philadelphia. Dr. Caudle, it's great to see you.
It's good to see you, too.
Of course. So we've all dealt with pink eye in one way or another throughout our lives. But poor Bob Costas, he seems to have a particularly nasty case of it. Did it surprise you, or should surprise anyone, how many days off he was forced to take because of it?
No, it really doesn't surprise me at all. You know, when we talk about pink eye or conjunctivitis, we're really talking about an inflammation or an irritation on the inside of the eyelid and also the white of the eyes. And that's why the eye turns pink, because it's irritated. But remember that there's a few different causes. I'd say the main causes of pink eye are viruses or bacteria, the infectious causes, and also allergies. But there are other causes, such as fumes and odors. Sometimes even using contact lenses can cause pink eye. But when we talk about infectious causes of pink eye, no, it doesn't surprise me the length of time that was taken.
I mean, clearly you haven't treated Bob Costas, but we got a pretty close-up look at his poor eyes. What do you make of his symptoms?
Right. Well, the symptoms can be very hard for patients. It's something I treat in my office all the time. And I'm telling you, a lot of people with pink eye, when they get this, are very uncomfortable. Sometimes the eye gets swollen. Certainly the eye can get red, as we saw on TV. But often there's tearing of the eye as well. Sometimes there's light sensitivity. And a symptom that a lot of patients with, say, an infectious type of pink eye complain of is they complain of, say, waking up in the morning and their eye is sealed shut because of the mucus and the discharge. That can be particularly bothersome. So those symptoms can be troublesome, and they can really be hard to work with, and it's really something to take note of.
And it is so contagious. That's the other thing that I think scares people so much. So what do folks need to know?
Right. I mean, the infectious causes of pink eye absolutely can be terribly contagious, can spread like wildfire. You know, a lot of people say, well, how do we prevent pink eye? How do I keep from getting it? The truth of the matter is the infectious types of pink eye are often caused by the viruses and bacteria that cause things like the common cold and ear infections. So you want to do the same things that you do to prevent the colds and the flus and stuff, that you want to do that to also protect yourself against pink eye. You got to wash your hands with soap and water. Also avoid sharing towels and other things like that. And really, if you're sick, if you've got pink eye, I think one of the best things that Bob Costas did, especially if it was an infectious type, was to take time off. You don't want to expose other people if it's infectious.
And keep your hands out of your eyes, which seems probably impossible when you're dealing with what he was dealing with. Dr. Caudle, it's great to see you making my eyes itch this morning. Thank you so much. Chris, over to you.